I think we look good, ready to go.
Okay. Good afternoon, everyone. I'm Amy Leister, and I'm with the Greater Scranton Chamber of Commerce. On behalf of the Chamber organization, I'd like to welcome you to today's webinar, which is Preparing Business for COVID-19, Yellow and Green Phases. I'm pleased to welcome Neil Weaver, Executive Deputy Secretary, and Michael Gerber from the Department of Community and Economic Development to bring us this presentation today. Today's webinar is a series of webinars that the Chamber of Commerce has been hosting for our members, for our community, and in partnership with our regional chambers of commerce. The event is being recorded and will be posted to our chamber's resource page following the end of the day, and that can be found at www.scrantonchamber.com /revive-NEPA. Also, the questions and answers will be available following the presentation for Michael Gerber to be able to moderate for us. And at this time, I would like to give an overview of our speakers. So Neil Weaver is our Executive Deputy Secretary for the Department of Community and Economic Development. Neil has over 2 decades of experience in nonprofit and government management, operations, and communications. During his career, Neil has served as the executive management at both the Pennsylvania Department of Community and Economic Development and the Department of Environmental Protection. In his current role as Executive Deputy Secretary, Neil functions as the Chief Operating Officer for the agency that is responsible for $1.5 billion through grants, loans, and tax credits to spur economic growth, community revitalization, and job creation, while providing strategic technical assistance, training, financial resources to help communities and industries flourish. As the Executive Deputy Secretary, Neil is responsible for nearly $180 million budget that includes both federal and state funding. His duties include all agency operations, including budget oversight and implementation, human resources, program management, and promotion. Neil is a graduate of Clarion University of Pennsylvania with a Bachelor of Science degree in Communications and currently serves as a member of the Board of Trustees for the university and as a chair of the Presidential Leadership. I'm pleased to introduce Michael Gerber, who is the Executive Secretary for the Department of Community and Economic Development. Michael currently reports directly to the Secretary Dennis Davin of the Pennsylvania Department of Community and Economic Development. Prior to his role as Secretary Davin, he has served in the agency's communication office as Deputy Press Secretary and Press Secretary since joining the agency in 2017. In his current role, he is responsible for assisting and advising the Secretary on day-to-day operations, program management, and special projects. Prior to joining DCED, Michael has served as the communications and administrative roles with the Pennsylvania Department of Health and the Pennsylvania Department of Human Services. He is a graduate of Bloomsburg University of Pennsylvania with a bachelor's degree in political science. And at this time, I am pleased to introduce Neil and Michael, and I'm going to turn it over to Neil.
Wonderful. Thank you so much for allowing us the opportunity to speak with you today. As Michael was introduced, I was thinking of what a valuable team member he is for us. The Secretary and I work really closely with Michael and rely on him heavily and have done so throughout the pandemic. And so everything you heard as far as my responsibilities have been thrown out the window with the pandemic, and it's really taken a whole new perspective of how we're working in this new normal, which you'll hear me say over and over again. So I wanted to start off by saying that I am not a fan of Zoom for a number of reasons. I don't know where to look. I also, the kids walk in my office, the dog walks in, and I'm looking around. It's one of those things I'm not a big fan of, but also it's tough to read your audience. So any jokes I make, I can't hear if you're laughing or if they fail. I also can't tell if the presentation's going too long. So just hang in there with me. I appreciate it. And if I start looking around, it's not my forte. So getting right into it. So the few past months have been incredibly difficult for all of you. your families, communities, and especially our businesses. And that is not lost on the agency or the governor. We know that the pain that this has caused, the closures that it's caused, and we've seen it and we've heard it firsthand. We've heard it from hundreds of businesses. We've talked to those businesses. We've heard, heart-wrenching stories about businesses that have had to shut down and what that recovery is going to look like for them in the future. And so one thing you'll hear me say more than once or twice during the presentation is we do know that the virus is calling the shots, unfortunately. This is unprecedented, as you'll hear the secretary has said over and over again. But we had to be proactive and do what we could to balance public health and the effects of the economy. I mean, the governor had to act quickly. He and our Secretary of Health, literally within the first few weeks of handling a pandemic, was also put together a team to work specifically on getting us back to the new normal. And so he pulled together myself, the Secretary, his top staff, and really we had a work group and we reached out to Gene Barr, who we spoke to almost every day, the president of the chamber, the state chamber, and talked to him and other members around the state, talk about what it would look like, recovery would look like, as we move forward. So I know that I'm here to talk about moving into the yellow and green phases, and I'll get to that very shortly. But what I wanted to talk a little bit about is what our agency has been doing and what the governor has been doing since the pandemic began. And the reason for that, as you'll see, it all rolls together. What we've done and how it's prepared us for the yellow and green phases and hopefully beyond. We put into place the COVID working capital access program, $61 million. We basically cobbled together through the agency. It was tough, and we provided that $61 million specifically. It was loans to small businesses. We had more than 740 businesses that were approved for funding with that $61 million. We know that's way out of the ballpark that what was needed. And we understood that. And so, we worked to figure out what we could do to help that. We also started working and having a meeting with industry. So we've had, since this all started, we've probably had about around about 15 industry meetings, and those were outreach led by the secretary and some of our senior staff to talk about what their needs are, how this is impacting them, what they're hearing. This was construction industry, real estate, a whole gamut of them, and we'll continue to do those. They didn't go great as far as the discussion, and I say that not because it was bad, because it again put it into light about how bad things are and were. And so really it gave us a sense of what we needed to do, where we needed to focus as we look down the road. We also put in place loan deferrals. So one of the things that early on that Dennis, the secretary, spoke with the governor about was, we have these loans that are put out there by our agency, and these are investments we've made. So we didn't feel it was necessary. It was right to continue to charge interest. So we did loan deferrals, and we had halted all payments in April, and then we did the deferrals for 90 days, and we're also doing that hopefully here another 90 days. We didn't feel that our small businesses that were struggling already to continue to pile on more fees and debt to them. And so that's been done. We also did that for borrowers to the Ben Franklin development authorities. We provided them with $1 million to help through their programs to make sure that they're helping their small businesses and the startup companies. We also opened up manufacturing portals, and these were done within the first couple of weeks. Of you that know are familiar with Brent Vernon, Sherry Collins, and Denise Brindley were put on this team. And if you know them, you know that when they get an assignment, they go full force, and they did as well with this. So basically what they did was identify manufacturers that could switch over and make the protective equipment that was needed, that was so very much needed. And we put that online. So businesses could go and look at that, could sign up so that it was known that was there. But we also signed up or created a supplies business to business. So these businesses could go on and find and be matched up with other businesses that are creating or have access to this equipment. And be able to pair them and match them, so that that as we move from red to yellow to green, we're still going to need that protective equipment. The hospitals are still going to need that equipment. That's not going away. And so we made sure that this was important and that we continue to do that. And also working with our international partners to help us with some of this outreach. We also are in charge of that same group, is in charge of a testing strategy for the governor. That group is specifically focused on setting up sourcing tests, so that we have tests within 40 miles, I think is the goal for people to be able to get tested. And you can imagine the amount of tests that are needed across the state, and to continue that ramp up. So it's not just hospitals. We're working with Walmarts and other organizations and businesses to set these up and to work with them as a partner. And so they've been out there working on sourcing these kits, working with businesses, and working with the Department of Health to make that happen. We've also been working with municipalities. These municipalities, just like the small businesses and businesses across Pennsylvania, were hit hard. This is something that they've never dealt with. I'm sure that the local elected officials and their constituents, as well as the state officials, have never really had to look at this or had to encounter this. And so our team, led by Rick Valello and Kim Bracey, have constantly been in contact with the governments, local, county, to talk about disaster response recovery plans, especially in our Act 47 areas. They've been hit hard, and they were already in a bad place. And so we've been working closely with them and the governor's office, and also working with PEMA to make sure that's all coordinated. So one other piece I'll touch on, then I'll move along. But you might have saw this morning and the other day and today, actually, we had two programs announced. So the state had received about $2.6 billion from the federal government for the CARES funding. And so we've been tasked with working that and putting that out on the street as quickly as possible. We know that this is needed funding. It's grant funding. And so we pulled this together and working with the legislators who were great to work with. And it was worked on and put together. Today, the one program is the small business program, and it's a $225 million program. It focuses on Main Street businesses, revitalization of those businesses at $100 million, disadvantaged business revitalization program, which is another $100 million. And then there's a loan payment deferral and loss reserve for $25 million. So this has to all be spent within the next, don't quote me on this, I believe 5 months. We are to get it out on the street. We are opening up the applications. The applications are going to go through the CDFIs. There's 17 of those that are going to be working on this program, and we'll continue to work with them. It was really important to get this money out in the street. The loans were great. They were a stopgap to help, but this is a lot of money. It's focused on businesses with 25 employees or less, up to $50,000. And the funding really is for anything COVID related, loss of revenues and helping the employees get back and anything that can be tied to the COVID and the hardship that they have faced. The other program that was announced today is the county funding that was provided through the Federal CARES Act money, and that's $625 million. That's a formula based on population. That's something that's already been predetermined. So that funding, the counties will apply through DCED, and they will be able to use it again for anything COVID related to the counties. But they also have the opportunity to establish small business programs and nonprofit programs as well. So, moving into what you're all here to hear about on overall is we were in the red phase. Everyone knows we were in the red phase. It was all the non-essential businesses were closed. Basically, our economy, as did the rest of the country, came to a halt. Again, we recognize this pain, the communities, the workers, each of you, and their families. But the plan to open Pennsylvania, again, we had started a recovery plan within weeks, but the governor was not going to open the whole state as a whole. It was dangerous, and it didn't follow. It wasn't going to help to flatten the curve as the governor and Secretary Levine have. Again, you'll hear me say it a few times. The virus is calling the shots. It will continue to do so, but we needed a plan, and so the governor came up with a measured plan to get us back on track and to open up the economy slowly in a way that we weren't going to affect public health and safety. So from the red phase, we had to look at what we could do, again, balancing public health and the economy. So the way we were looking at moving folks from the three phases was really had to do with where they are and where they were with number of cases. And there is a formula we can share with you as far as where that information is located. The number, its hospital capacity. One thing that the governor did and Secretary Levine did was this measured approach. Not only helped us flatten the curve, but it helped us flatten the curve by making sure that our hospitals were not overtaken and able, that they had the capacity to handle the enormous amount of cases that were coming through the doors. And so by doing that, we flattened that curve. And so as you can see on the screen, I don't want to go through and read each of these, but this is us moving through. So in the yellow phase, which, I understand you all went into the yellow phase and did a great job with again, flattening the curve and numbers going down and are in the yellow phase. So in the yellow phase, we're still asking for there to be vigilance and make sure that you're taking the precautions needed to protect you, but to protect your employees and your customers. And the other piece that we've talked a lot about is this isn't just about those main pieces. It's about their families as well and their friends. So, it's protecting the employees and everyone else. It's protecting you and everyone else as well as the communities. And we've really tried to stress that. So we're still, we've asked that people still telework when possible. Some businesses, that's just not possible. And we understand that. I would tell you from where we are in Harrisburg, we are all still teleworking, and we'll continue to do so for a while. With what we've done in getting that money out the door quickly, we've done that all remotely, and it's been phenomenal. But back to this. So I would say that you need a plan. Above all, you need a plan, and you need to stick to that plan if we want to keep the numbers down. So it includes things like creating stringent protocols for cleaning, for disinfecting plan, making sure that's done every day, quite frankly, and that there is a plan on doing that and how to do that. It's establishing protocols for when there is a discovery of someone that an employee has been in contact with someone with the virus or is FU, it really needs to, we call it contract testing. And it basically is, looking at who you've been in contact or who someone has been in contact with that may have the virus, and it going back and looking at that. You need to identify those folks and identify them. Now, again, there's all kinds of laws about health, privacy, and protection, but you also need to make sure that your folks are aware of the signs and the symptoms. We have been asking that businesses do temperature screening for staff. If you go to, I believe it's McDonald's, there's signs before you, when you're go to the drive-up window, that they're all being tested or screened for with their temperatures. We've also asked, one of the other ideas is proposed is staggering your work times. Having some employees come and not everyone in at one time, staggering when they come in, making sure that rooms, if you have office space that has locker rooms, that they're not, if they're not necessary, to close them off, and make sure that, again, that we're taking the precautions. And there's a lot more that have been recommended. And at the end, I think there'll be a few places where we can send you for more guidance as it continues to evolve. And I believe the presentation will be available to everyone. And if we'd like it sent out, we can do that as well. But again, the most important piece of this is planning. So how do you move to green? That's a question we get a lot. And what does that mean when you get to green? The Department of Health, along with the governor, have created, again, it's a CMU model. Carnegie Mellon University model is what we look at, that has, again, a number of different determinations of moving out of those. And some of those are, again, based on the numbers, whether they're increasing how much the contact tracing, the available testing in an area, again, the hospital capacity, and looking at all of those and the availability of testing, like I said. When you move into green, and I think, Michael, that is the next slide. Nope, sorry. Yeah, it is. Either one. We can stay on that. The important piece of this, is that moving into green does not mean that we basically go back to normal. Green is moving us into the new normal. And while I believe that the new normal is now just normal, we need to look at this very carefully. So again, most of the restrictions in green are lifted a little bit more, as far as restaurants and bars can open at 50% occupancy. Personal care, as far as barbers, salons, and that type of businesses can open at 50% occupancy. The masks, again, I didn't say that under yellow, but obviously the masks and wearing masks when safe to do so is very important. We do understand that and have addressed that some businesses, manufacturing and others, it does cause a safety hazard to have those on. It's also, we've heard from a number of businesses that it's not possible to have them on all day. There's a lot of fatigue with wearing them, and if folks are wearing safety glasses, they get fogged up from wearing them. So, within our guidelines, we ask that people wear the masks unless it's not feasible or not safe to do so. Again, we're asking for folks to telework. We need to continue to flatten the curve, and to do so, we need to stay vigilant. And so again, green does not mean that we're lifting all restrictions, but we're doing so, again, measured, so we continue to move people into green. To be honest, or not to be honest, to let you know that these were done county by county. We, again, weren't going to lift it all by region or move folks from red to green to yellow statewide. So we're doing it county by county, and we're looking at the numbers again with those restrictions in place. And so the business guidance that I mentioned a little earlier can all be found in this, and there's a website provided. It really walks you through what the guidance is, a much deeper dive than what I just provided as an overview. And then the next slide is also the safety measures industry specific to that. And that's where, with the real estate industry, vehicle transactions and how that can work in the different phases, that's also listed there as well. So I just want to say once again, is that the key takeaway with this is that green is not a return to normal. Green is going to a new normal, and we'll continue to do that and to enforce that, and with everything we can do as far as guidance that the governor will provide and the Secretary of Health. The next slide is again some more links about the business guidance in the various phases. I believe that is, if I do this right, is our last slide. Before we open for questions, Michael and I will be on this together. Michael's been very involved with the details and working on a few different programs and groups that we have put together to address moving from phase to phase. So Michael and I will both be answering questions and then adding on to anything that we miss. What I would like to also, before we do open it up, is we will try our best to answer all the questions. We may not have answers. If we don't, Michael or our team will get back in touch with you as soon as we can, as soon as we have an answer for you. And specific questions, we'll try to answer as far as, if you have a specific question to a business, a specific business with specific details and issues, we might not be able to answer that. And so we'll have to get back to you, and we'll try to keep those questions at a minimum, just so that, we have time to go through this all. So with that, I believe we're opening it for questions. Is that correct?
Yes. Yeah, Neil, we've gotten a few. There was a question that just came in asking, is there a plan to remove counties from green, or will they continue to stay green indefinitely?
That's a great question. We've been getting that question a lot. I can tell you there isn't a plan as of today. We are working on a plan. The governor is working with the Secretary of Health to see what that means. Again, we need to keep the numbers down. And when we continue to get those numbers further and further down, we'll look at what that means to get out of green. But for right now and for the foreseen future, we want to get everyone to green, and then we'll go from there. But guidance will be coming out on that.
Thanks. We have a question asking, is there any discussion about when restaurants can move beyond the 50% capacity?
Yeah, so again, the governor and the Secretary of Health, and I hate to keep going back to it's being developed, but they're working on those plans. We hear from, again, restaurants and bars all the time about what effect this is having, and 50% isn't really helping them, and that it's getting there. So we're working on a plan to get everyone back up to capacity. And one thing I forgot to mention was we're one of the few states that started out as doing a phased-in approach. Again, the governor was not going to just lift the order statewide. And so we are on a 7-state council with the surrounding states, and we are far ahead of the way that they've put together their phase-in programs. And so we're really a leader on this. We have calls with them once or twice a week, the Secretary and I, on separate committees to do that. And so we're also gathering information from them, delivering that back to the governor's office for things and ideas that we may not have thought of. And we'll continue to do so to make sure we're getting everyone back open.
Yeah, and Neil, I think if I could jump in there as well.
Sure.
One of the reasons why we're not immediately talking about exiting green phase for some counties is because just with the nature of this virus, with a lot of people, not knowing they have it, or with a lot of people, not knowing they have it for, 2 weeks or so, there's a delay, right? So as a result, there's a delay in terms of us being able to see the results of the policies that we're implementing. So the last thing we want to do, and this was true with going into yellow phase, this is true going into green phase, and it's also true when eventually we move beyond the green phase, is last thing we want to do is move too quickly, have people come out of the green phase without the proper data for us to know that it is safe to do so. So the collection of that data does take time. We want to look at the trends. We want to look at the public health data that's available, infection rates, things like that, hospital capacity. But it's a complicated formula. And I understand why some people, especially in some of the less populated counties, not necessarily Lackawanna, but when you're talking about some of the more rural areas, they might say, we barely have any cases. We want to get out. We want to get out of the green phase. We want to go back to normal. But that's just not the proper thing to do from a public health standpoint right now. So like Neil said, additional guidance is coming, and be on the lookout for that. But right now, our main goal is trying to get everyone to the green and then assessing from there, what the next step could possibly be. So Neil, looks like we got another question here. Is there a detailed approach for a retail business that gets notified that a guest who previously visited subsequently is tested positive for COVID-19 to notify the Department of Health?
Yeah, so again, this goes back to the trace testing and contact tracing. That's really what this is. So when we are notified, or when the Secretary of Health is notified in the office, they have a team. We've hired hundreds of people actually to do this, where they will then contact the business if someone has been in your business and has been either as probable or has tested positive. And the way they do that is they basically sit down and do an interview. For lack of a better term, is basically they'll ask you, where have you been? What have you done? Who have you come in contact with? So that they can kind of trace that back. And make sure that folks are notified. They don't tell, obviously for HIPAA reasons, they don't tell the business who it was. They just notify them, as well as notifying people, just to let them know that they were in contact with someone, and to be looking out for symptoms they may have, and a lot of times is doing the quarantine for the 14 days, depending on the severity of it.
Thank you. Now, this is a question about schools, saying the opening of schools is impacting our staff. Any information on when or how schools will open? Also, if parents cannot work due to school issues, will they be able to collect, I presume that means collect unemployment?
Yeah, so the question about unemployment, I don't know I think I have an idea of the answer, but I don't want to give the wrong answer, and Michael might know that. But as far as school is concerned, guidance came out earlier this week, I believe Monday or Tuesday, from the governor's office and the Department of Education, really outlining what that will look like. And and I go back to the business piece, the part of this is planning, and they've asked for, they have to have a plan in place to go back to operating in the fall. So there has to be a plan in place, again, that would follow much more stringent operations to make sure that the children are safe. Some of the answers that have been, or the questions and responses that people have been providing, and ideas is, desks 6 feet apart, staggering start times, shortening semesters. I know as I sit as a board of trustees at Clarion University, they're trying to figure out what the university does this fall. So there is guidance, and we can get that to the group. But as far as unemployment, Michael, do you have an idea with that?
I don't off the top of my head, but we can certainly get in touch with the Department of Labor and Industry and get back to you on that one.
Great, thank you.
Yeah, and the other thing, and I think my screen is still being shared. If anyone does have any questions after this presentation, that you don't think of during the presentation, please feel free to email either Neil or myself, and we'll be sure to get you the answers that you need. And I did send the Department of Education guidance to the person
Great.
who was asking, so that should help.
Wonderful, thank you.
Yep, and there is a question here. Is there information on how to access the community tracing process?
Yes, we will. We can put you in contact with the Department of Health. We talk as they've staffed up for this. It's gone very quickly, and we can give you that information where it is and how it's being done, and as far as, and also providing the opportunity to sign up and to do this through Department of Health.
Mm-hmm. And the other thing I'll point out is the Department of Health actually just recently created dashboards for counties to be able to track where they are and track where their metrics are. So this isn't directly related to contact tracing, but they do have tons of great information. If you're wondering maybe how close you are to getting to the green phase or kind of what your county numbers look like, they have a great dashboard that they set up that you can access all that information in one place. And that's at the Department of Health website. So if you go there to health.pa.gov, it's pretty much right there on the front page for you, so you can access that as well.
And I'll add on to that, Michael, on which I didn't say during my presentation, is Department of Health with our staff and our talented IT folks have created the testing map, where you can see where everywhere that we know are doing testing. It's the hospitals, I think the CVS, the Walmarts, and where those are, and you'll see those are continuing to grow as we move forward with our partners.
Thank you. There's a question regarding retail. In regards to retail, if a retailer has a customer that tests positive, then the store staff will have to quarantine for 14 days. I'm not sure of the exact guidance to that. There actually is guidance, and Neil, please feel free to jump in. There is guidance for public-facing businesses, such as retail businesses, that really outlines all of that. So that, I believe, is in the COVID-19 business guidance here, this first link. And again, we'll make sure that at least the links in this presentation will be sent to everybody who's participating here. But there is specific actions that retailers can take in order to, in the event of a confirmed positive or a possible positive case for either their customers or their employees. Let's see. It looks like that might be all the questions that have come in so far. We can hang on here just a minute to see if any other questions filter in.
Sure. I mean, I could just talk away, Michael. I'm never lost for words. So
let's not do that. I hear enough of that every day.
I know.
Yeah. So I mean, again, we will make sure that you get all these links, that all these are available to you. I recognize, and we recognize that there's a lot of links here. There's a lot of different guidance for different industries, and it's difficult to follow all the time. We are always working on ways to streamline all these pieces of guidance and organize them in the most logical way possible, so that if anybody has a question about retail or has a question about restaurant industry, they'll be able to find it pretty easily. But if you, for some reason, can't find anything, let me know. If you are going through this and you can think of a way that things could be organized better, we're always open for additional feedback. So please just let us know. And that goes for the guidance that's out there, and that really goes for anything. Mm-hmm. We're not trying to do this in a vacuum. Certainly, especially over the past 4 or 6 weeks, we've been really trying to listen to the business community and what their needs are, and try to respond to what those needs are. Now, there's always a balance between business needs and public health needs. Walking that balance is difficult. It's difficult for us. I know at DCED, when we're used to helping businesses expand and helping businesses locate into Pennsylvania, and now in this new normal that we're in, it's the opposite of that. And we're trying to help businesses kind of slow down and take a more measured approach. So it's new territory for us. It's new territory for a lot of people. But with that said, we're trying to engage with the business community through things like this and through the various other calls that we're doing to try to make sure that we have open lines of communication. So we did get another question here. What is the guideline on the mask wearing in the green phase?
So again, it's highly recommended. The governor has said over and over again that masks should be worn. Masks should continue to be worn. And so again, this is guidance, and we're doing this to be safe. And this should be part of everyone's plans. I believe in the when you receive the Department of Education, they are going to be requiring masks for kids, and so. It's a guidance. It's highly recommended. The governor believes that this is the way that we have been successful in flattening that curve. And if you look at the numbers, the past few days, they're all lower by a number of them. We're down around the 400 to 450. We're staying at that. It's not perfect. But if you see where we were 1,200 at one point, and so that's really is a it's the work of everyone that they did to wear those masks and to take those precautions.
Yeah, and I just sent around an FAQ document from the Department of Health that actually has a lot of really good common questions and answers about mask wearing. So I sent that, I think, to the whole group. So please take a look at that. Like Neil said, especially in the green phase, we want everybody to wear them. As long as it's safe to do so. If an employee is having trouble for whatever reason, for a medical reason, or it's impeding their ability to work safely, then it's really their call. At that point, we're not going to make people wear them if it makes their job unsafe. But like Neil said, it's kind of part of the idea that we're all kind of in this together, and we're all trying to kind of make sacrifices in order for the public health to. In order for us to keep improving our public health situation.
Well, and I would add, I would add too that we are taking all of your suggestions. We have a seat at the table where the decisions are being made. The governor has included our agency as well as others, but has really put us on the forefront of the recovery plan. And so we're continuously talking. We bring up the concerns that we have for industry and what we've heard. We continue to talk about, the need to move forward for industries and to open, but open cautiously. And the governor and Secretary Levine have been very open, and again, we have a seat at the table as far as this recovery, and it has worked. And again, the governor is a businessman. You hear him saying it, and he is. And so he understands what businesses are going through, and he understands the amount of hardship this is having.
We do have another question. We've achieved yellow phase on June 5th. Best case scenario, when would we begin a green phase opening?
I was waiting for that question. So again, going back to the, Michael, if you could go back to the slide that kind of outlines, there it is. So if you take a look at the slide that's up here, and we can provide that to you, but there are 4 metrics that they use. And again, if you go to the Department of Health's website, they have a link to the CMU data that we look at, and that the governor and Secretary Levine look at the data and the numbers to drive their decisions, again, based on what the virus is, where it's heading. So if you look under those metrics, it really is a formula driven to make those determinations. So again, it's contacts of cases that are being monitored, again, through contact tracers, the amount of testing and how many positive rates we've had over the past 14 days, hospital bed use. That really is a big deal, and I think we really have to look at how important it was for us to take the steps that we did in the phases. We never had an issue where the hospital bed use was overrun. We did not have those issues, and we think that's because of the way the decisions that were made by the governor and by Secretary Levine. And so if you take a look at these are the metrics. And again, if you visit the Department of Health website, they have a link to the CMU model, and you can look at that over time and what that's looked like.
Yeah, we do have, this is more of a comment, talking about a challenge. The problem is the fear of repercussion, both from the public as well as from the state. Most small businesses don't have time to, sit on one of these calls for an hour and nevertheless consume the massive amounts of information from all of these links.
No, that's a good point, and we hear that a lot. And one of the, I'm not going to get into a political debate. It's a good thing everyone's on mute, so I don't get booed off the call. But there is the information that the resolution that was passed the other evening by the legislature was not helpful. You can agree that we should be opening quicker or not agree, but that has just caused a great deal of confusion in addition to the confusion that just is what it is. I will take this back. What I can tell you on repercussions, again, the governor has said this over and over again. He is not going to send the National Guard out. He's not going to, he has used the power that he has under the emergency declaration to implore people not to be or to take things seriously. But there's been very little activity that I can point to or anyone can point to where the state police were involved. Repercussions on customers from customers. I can't dive into that. That's not really something I know a lot about. Again, I can just tell you from the state perspective, we're not coming to knock on the doors. The governor thinks that's a really bad use of resources, both National Guard and local as well. And it really is a local issue from municipality to municipality.
Yeah, and really the guiding philosophy in terms of enforcement of all of this stuff, from the original closure order to the waiver process to some of these health and safety protocols, has always been one of basically starting with just warnings, more of an education, and then if a business continues to knowingly continue to break the policy, at that point that's when actual real enforcement actions might be taken. But no one's going to be shut down because an employee isn't wearing a mask or something like that. And this is the first time that it's happened. So we certainly don't want to set that expectation. The governor has been pretty much, as Neil mentioned, he doesn't want to, have this become like a highly policed sort of thing. A lot of this guidance is put out there for businesses to use this and take it upon themselves to implement these policies and procedures, not have it forced upon them through the threat of enforcement or anything like that. That's really the guiding philosophy of all this. The enforcement mechanism is in place if it has to be. But with that said, for first-time violations, things like that, you're almost always just going to get, a quick word, saying, hey, you should be doing this, you shouldn't be doing that. And that's kind of how it's been with the state police, and I believe with local police units also.
And I'll just finish with this on that comment. As far as it being confusing, we understand there's a lot of information. You're not just getting it from the state, you're getting it from the federal government and from other states, quite frankly. And it is confusing, and it's a lot of information, especially for our small businesses to really be looking. And we've been working on that and we'll continue to do that about how we communicate this and how we really are providing any guidance we can to the small businesses. Again, if you are talking or you are a small business owner, please feel free to call us. We will walk through whatever questions you have. If we don't know the answer, we can either talk to Department of Health, or we can talk to them for you, or have you talk to them. So we want to do what we can do, especially our agency, as we always have, to support the businesses in Pennsylvania, whether it's in Philadelphia, or whether it's in Erie, or whether it's in Tioga County. We want to make sure that everyone's getting the same information.
Thanks, Neil. It looks like that's the end of the questions that we've received. If anybody does have any other questions, again, I advance to the slide here with our email addresses. Please feel free to email either of us or both of us, and we'll be happy to take your questions at any time.
And I see Amy just popped up.
I did. Okay. Well, first, while we're waiting to see if we have any last questions come in, on behalf of the Greater Scranton Chamber of Commerce, Michael and Neil, thank you so much for bringing this information to our membership and the community, and giving us an opportunity to address some questions and concerns that we may be experiencing here as we are currently in yellow and moving to green phases. Again, for all of the attendees, thank you for joining us today. This is a series of COVID-19 webinars that we've been trying to bring to the community. We will be planning additional webinars upcoming, and we have a slide that shows the next upcoming webinar that we have. There it is, scrantonchamber.com/events. You can attend. We have on next Thursday, June 18th at 9 o'clock. In a response to COVID, we are launching a micro internship program under our small business internship fund. So for all of our chamber members, please tune in to that to learn about the initiative and what the program is about and how you can host an intern. And this presentation will be recorded and posted to the Chamber's website, and we'll put the PowerPoint up as well. So again, thank you, Michael and Neil, and to everyone on the call, and have a great day.
Thank you
Thank you so much.
Okay.